How is blood pressure treated? Once correctly diagnosed, hypertension is usually present for life. There remains some debate as to what level of blood pressure should be treated. The decision can be influenced by whether or not the patient has other conditions, such as diabetes, kidney disease, or heart disease. If these are present, treatment for blood pressure may be recommended, even when levels are below the generally accepted level of 140/90 millimeters of mercury. Marginally raised blood pressure may come back to normal with the lifestyle changes that are important in the treatment of all patients with hypertension. These include losing weight if you are overweight, keeping salt intake in the diet to a minimum, and eating a healthy balanced diet. Reducing alcohol intake to less than 21 units per week for men and less than 14 units per week for women. Taking regular exercise, ideally a minimum of 30 minutes continuous exercise at least 3 times per week. Stopping smoking. If these lifestyle changes alone are not successful, then drug treatment is likely to be needed. If medication is prescribed, it is important that it is taken. Treatment has been shown to both reduce the risk of the long-term damage caused by high blood pressure and to prolong life. High blood pressure generally produces no symptoms. The aim is to find the most appropriate treatment for individual patient circumstances. Patients with raised blood pressure are generally well, and remembering to take regular tablets in such circumstances can be very difficult, but it is very important. There are many different types of drugs that can be used to treat hypertension. Diuretics, commonly known as water tablets, help the body to lose salt and water through the kidneys. Beta blockers slow the speed and the force of the heartbeat, reducing the pressure generated. Vasodilators, which include ACE inhibitors, angiotensin II receptor antagonists, calcium channel blockers, and alpha blockers, all act by dilating blood vessels in the body. By doing so, they reduce pressure within the circulation. Drugs that act on the blood pressure control centers in the brain. It is important that once the question of blood pressure has been raised or treatment started, then the blood pressure is checked regularly.